Partners in Care is a compounding pharmacy serving Gainesville, Georgia and surrounding communities. Caring for you like family is our goal. Our pharmacist has the training in bioidentical hormone replacement, men's health, pain management, wound care, veterinary compounding, and endocrinology, just to name a few. We answer patients' questions, make physician referrals, and work with the physician to create a unique formulation to solve the patient's problem. These are just a few of the problems that can be solved by a compounding pharmacist. We care enough to listen to solve your problem.
Well, compounding pharmacy is the preparation of a custom medication for an individual patient based on a doctor's order. So compounded prescriptions are custom made. They are made to order for that particular patient.
I've known Chuck Fulmer for several years, and he's provided great support to our OBGYN practice through compounding hormone products for our patients. He's always readily available whenever we have questions, and he formulates products, tailors them specifically to each patient's needs. So he's been a great source of information for us, as well as providing a source of treatment for a lot of our patients who are dealing with different hormone issues. I trust Partners in Care without any reservations whatsoever. And there are certain situations where we may use more standard pharmaceutical products where we don't need his expertise, but he's certainly involved in all of our complex cases and all of our difficult management cases. And for those patients who prefer compounded hormone products and natural hormone products, he's always our first referral source.
I have never heard of a compounding pharmacist before. Didn't know what they were, what they did. And it was through my doctor. When I went to her with some issues, she recommended bioidentical hormones, which I was a little resistant to because I like to keep things as natural as I can. We talked about it, and when I agreed, she said, well, then you need to go see Chuck Fulmer at Partners in Care, and he will compound a specific prescription for you to suit your needs. So I thought that sounded pretty good, and that's what we did. And I worked with Chuck and his staff. We had to make some adjustments along the way. It's not always right the first time. You figure out what you need to adjust. I found Chuck to be very easy to work with. Staff was great. When I had a question or a problem, I could call him, tell him what was going on. He would say, well, maybe we need to adjust this or that. He would talk to my doctor. They would decide to change the prescription. He would mix a new batch, and I would go pick it up.
The relationship between the patient, the pharmacist, and the physician is referred to as the triad. And it is a working partnership with the physician, the pharmacist, and the patient, communicating to solve the patient's problem. And so much of the solving of the problem is the communication process. I mean, the patient has to listen to their body, how it responds to the treatment. They have to take their medicine as prescribed, because if they don't, we're basing anything we do on false information. And then the communication back and forth, and it is an important part of the process.
Partners in Care uses only FDA-approved chemicals from FDA-approved manufacturers, taking every precaution to ensure that your medication is compounded in a safe, clean, and sterile environment.
We've got a USP 797 approved clean room. Now, this is a positive pressure clean room, the idea being with positive pressure that the outside contaminants cannot enter the room. It's divided into 3 rooms. The highest is in the room where the sterile procedures take place. Then there is kind of a transition room with the pressure is next highest, and then there is the gowning and work area where preparations are prepared, and that pressure is the third lowest. And the lowest pressure is in the regular compounding area outside of the clean room. The idea is that the differentials in pressure will cause the particles, if there are any, to be kind of swept out by the air pressure, keeping the environment clean. This area is checked by an outside inspector every 6 months. The pressure, the temperature, the humidity, all of that is measured so that there is no chance of growth of any kind of bacteria. There are tests done on the floor surfaces, the work surfaces, the ceiling, the walls, to make sure that if they're cultured, that nothing grows. And this is done and recorded periodically. It's kind of unreal when you think that you're taking bacterial samples off of a floor to make sure that you don't grow anything.
Yeah, I've known Partners in Care about maybe just a little over 2 years. My wife also uses Partners in Care. We both go to a doctor called Dr. Jew, who's in the rejuvenation business. And I'm so old, I'm as old as dirt, and so I think I needed a little rejuvenation. Dr. Jew has specific ideas about what I needed specifically, and the only way that she can get that is by having a compounder who she discusses with the pros and cons and what can actually be compounded and cannot be compounded. And they come up with with a drug that I can use to the ultimate. Whereas when you sometimes go buy a regular drug at the drugstore, you're getting a compound that's been done for 20 million people, and like everything else, one shoe doesn't fit all. And that's why you got a guy like Fulmer to give you those kind of drugs that you need, and not a bunch of jazz, which you don't need.
We found out that administering injectable progesterone to patients who had had a previous early delivery or preterm delivery would decrease the risk of it happening again. And there are many, many complications that occur with early delivery. It's one of the main areas that we can intervene in obstetrical care and produce a better outcome with better babies, healthier moms. So when we have a patient who's had an early baby before, if we administer them weekly injections of progesterone that can be compounded by Chuck and Partners in Care, it can greatly decrease the risk of that happening again. So instead of a mom having to be separated from her baby and the baby spend months and weeks in a neonatal intensive care unit, she's got a higher risk of taking that baby home the day after or a couple of days after she gives birth. And anybody can see the value in that. When you've worked with a pharmacy like Partners in Care for almost 20 years, and you see time and time again when your patients are satisfied, when me and my associates are satisfied, also my medical assistants in the office who are often working with the patients and being an intermediary between the patients and the pharmacy, when everybody keeps saying that they're satisfied with the care, it's a good thing.
Chance is a 7-year-old mixed breed terrier that we adopted when he was 3 months old. And about 1.5 years ago, Chance became acutely ill, and basically we were told he was going to die from a rare blood disorder. And so we sought a second opinion at a hospital in Atlanta, and he spent 6 days there, and they told us his 1-year survival was 5%. He's 17 months into that 5% survival, so he's beaten all the odds. And part of his treatment involves using several drugs, primarily used for humans. And one is prednisone, which we can get at any pharmacy, but he's also on a compounded product of something called cyclosporin. Cyclosporin is a drug in humans that's used to prevent rejection of transplanted organs. And what it does in Chance is it prevents him from rejecting his body's own red blood cells, and that's the source of his problem, is that without the medication, he'll become profoundly anemic and just die. I called Chuck and told him the story, and he said, no problem, I can take care of it. So for the past probably year or so, we've used Partners in Care exclusively for Chance's monthly refills. My family jokes that I love the dog more than I love the rest of my family, which is not true, but he does require a lot of attention. He gets blood work drawn every month. His labs are stable. They won't make any further projections of how long he might survive because he's already exceeded everybody's expectations, but he's doing well. He, 2 weeks ago, caught a squirrel, and that's how energetic he is and how active he is.
I've got one customer, 5-year-old with a heart problem, and you know, you sit there, and I had a handicapped son, and I realized the problems that you go through. And recently we had a incident where the flavor was changed inadvertently. Dalen's mother called me and told me that he said it doesn't taste the same. And I said, I'm aware that there's been a change, and we have reordered the brand that we previously had. And I says, it'll be in here Monday morning. If Dalen can make it through the weekend and tough it out, we'll have his preparation with the correct taste Monday.
The cardiologist, Dr. Wes Lindsay with Children's Healthcare, prescribed him a medicine called flecainide that is, it's like an adult dose medicine that has to be compounded down into a child's dose. It's the last ditch effort before surgery, which nobody wants a 5-year-old to have a heart cath done. So he prescribed it, you know, told us up front the fact that it had to be refrigerated, you know, given 3 times a day, and that it had to be compounded, which raised a lot of questions. Did some research on compounding pharmacies, and there's a lack of them, especially where we live. I got in touch with Chuck at Partners in Care. I took the prescription in. The cardiologist had answered all the questions I had from him. I went to Chuck himself, and we sat down and talked about compounding, spent 10 or 15 minutes with me, prescribed, got the medication taken care of. The next day, got it picked up, and my son's been on it and has had no adverse effects. All of his cardiologist appointments have been good. Everything's checked up right. I tell you, he even went one step farther the last time that we had our medicine filled. My son took it, and it kind of had a weird taste, and they flavored it with marshmallow. Well, my wife called up there and got Chuck on the phone and said, something's wrong with the medicine, the flavor of it. And he said, I told the company that I get my flavoring from that it was different. So he didn't have to, but he got the old flavoring and redid the full amount of medicine for me and didn't charge me a dime for it, just because my son didn't like the way it tasted. So coming from somebody who this is the only option we had before surgery, I'm glad there was a compounding pharmacy there. I'm glad that Chuck, you know, he's been doing it forever. He's super nice, takes time to break things down. So if it wasn't for the compounding pharmacy and being here and the medicines that they provide, we would be doing a heart cath on a 5-year-old little boy. And this is buying us time until he gets a little older. He's a pharmacist, I guess you could say. I mean, he's done it all, seen it all, and you can tell I'm not just a number, my son's not just a number. You know, every time I go in, he comes out and asks me, how's he doing? You know, how's the medicine working? So I'm very pleased with the outcome of the Partners in Care pharmacy.
When it comes to choosing a compounding pharmacy, you need to consider the knowledge, the expertise, and the experience of the pharmacist and the staff that is working on preparing your product. All of our technicians are sent to Houston, Texas to be trained by Professional Compounding Centers of America. We just don't have anybody preparing your medication. There is training, expertise, and knowledge in every person that handles your medication.
I feel like they really care about me personally and their customers in general, and I'll tell you why. I was in there last week, I think it was, picking up a prescription. And while I was waiting, Chuck was dealing with an issue. And I wasn't eavesdropping, I just happened to overhear what was going on. It seems that a supplier wanted him to accept some ingredients that were going to go out of date in a short period of time. and Chuck wasn't willing to accept that. He felt that it was below his standards. That made me feel really, really good, knowing that he was keeping track of that kind of thing. He wasn't going to let his ingredients go out of date or accept something that was substandard. His standards are high, and I'm very glad for that. I'm grateful for that, because that means that I'm getting really good product.
You've heard from some of our patients, you've seen some of our prescribers, and you've seen the steps that we take to assure that the compounds that we release are the highest quality. Now, how do you go about choosing a compounding pharmacy? I call it the 4 E's and 2 I's. The first E is education. This is a never-ending process, but it is necessary for the pharmacist and all members of the staff. Equipment is second. Compounding pharmacists must have the proper equipment to prepare quality products. There are products that cannot be prepared without the proper equipment. Some of this is quite expensive. The ointment mill or the sonicator, which is an ultrasonic homogenizer, a certified 797 clean room is necessary to prepare sterile products. Expertise is necessary to properly clean, use, and maintain all equipment and facilities in the compounding pharmacy. Excellence in all phases of compounding is essential and a never-ending task. Innovation is mandatory to prepare the highest quality products to solve an individual patient's problems. It is necessary to continually research the latest therapies and compounding techniques. Integrity is essential for all members of the compounding pharmacy. It is doing the right thing when no one is watching. Having a culture in the pharmacy that allows the technician to come to the pharmacist and say, I don't feel comfortable with the preparation that we just made. We need to do it over again. It is the pharmacist ordering just the destruction of a product that may not look pharmaceutically elegant or does not pass potency testing. I'm Chuck Fulmer. We at Partners in Care take time to listen because we do care, and I thank you for watching.